So here we are again, and we are going to be looking at part 2 of our discussion related to chapter 4, which is our first chapter in unit 2. So let's get to our screen share, which means I have to always go through my little rigmarole to get to that, and then there we are. Oh, I'm not there. Well, we'll do this without me, having my little face right here. Oh, surprise! There I am again. Let's get to this. Ah, I'm back. You get to look at me. All right. So we want to be aware that the scientific model is a kind of a Western process, way of thinking, but that doesn't mean that it is the only way of critical thinking, but it's a good one, and you can compare and contrast that to other ways of exploring a critical thinking process. So we can all be researchers. In fact, we are all researchers. Whenever we look something up, we are researching. But as a student, you could actually check out the Massage Therapy Foundation, which I strongly encourage you do. And they actually have a little online course on research literacy, which I strongly suggest that you do. And they have a case report contest. And so they have recently upgraded their requirements for how you will use a framework to create a case report. They're using the CARE framework, which allows an upgrade in the way that massage therapy research is presented. So this is going to talk to you about the different types of research and the importance of ethics in research. And so there's something called, especially with human research, there's something called an institutional review board. So there's an overarching group that is making sure that we are, when somebody is involved with research, that they are doing due diligence to make sure that nobody was harmed in the research. The schematic talks about, what are the different steps with that, but it starts with your question. You might want to know, you might have a client or a student that you're working with that's taking a particular medication, and you might want to know how massage, the relaxation response of massage is going to affect that medication. Maybe it will, maybe it won't. So that's how you're going to start. And then you have to start gathering all your resources, and I suggest you start with Medline Plus. And then you go, okay, based on what I know now, I am going to say that a person who is taking XYZ medication, none of the known physiological effects of massage are going to specifically interact with that, and so it's not, the medication and the massage are going to be fine together. And then now, because there's a null hypothesis, which means that massage is just fine when a person is taking this medication, is our hypothesis. But our null hypothesis is massage is not okay for when somebody is taking the medication. And as we collect information and critically look through it, we may find that we learn something that is going to tell us that our original hypothesis is not a good one, and that we need to stop and rethink how we might go forward. So then we have to go, okay, now how am I going to get information? And there's the library, there's Medline Plus, there's PubMed and various search programs. There's your textbook can give you some starts with that. You can look at other papers that people have written related to this that maybe haven't gone through the whole peer-reviewed process. You can take a look at publications that relate. You can talk to other people. You can start to collect all this information. Like with our medication, I might chat with a pharmacist and see what their opinion might be about this. Once I gather the information, and then I have to put it together in some sort of a platform or a format where I can look at it analytically. I can get the pros and cons on it. I can screen for bias. I can get rid of the idea of causation and correlation, and I can kind of narrow it down. And then based on that, I can start to make my decision. And I can then, with our little idea about, well, is massage going to affect the use of this medication? I can now say in this example to the client, I did some research on this and I talked to some people that are familiar with this drug, and I talked to other massage therapists, and I looked on PubMed, and it appears that massage does not have any contraindications about how it might affect this drug that you're using. So research in plain language, that's what this is about. That's taking you through that process that I just described. And you want to do this. During the course, I will be posing questions to you. It might be a group activity or a little project or something like that. And with our Zoom meetings, I might say, okay, here is a little case, here's a little scenario, and here's the complication we're dealing with. This person is involved in some sort of ongoing treatment. I have glaucoma, let's use that. Are there any issues that I need to be careful of if I were a massage therapist for me? And there are some. It has to do with positioning. It has to do with some surgeries I've had with my eyes, how I can't put any pressure on them. It goes along with the idea of the results of the vision loss, where I have to be real familiar with an environment before I'm not as cautious about moving around in that environment. The pressure in my eyes could increase if my head is down or face down. So that's all stuff that would need maybe to be addressed in how we're adapting massage. And then, my hypothesis would be, how do I have, in order to adapt to this particular client, I'm going to do better with them when they're on their side, because the face cradle and the face down and how it might put pressure on the eyes and all of that. I'm going to make sure that I do my due diligence. I'm going to look stuff up. I'm going to look and see if they've got a medication that goes with that. And then I'm going to sort that out. And then I'm going to be able to make my adaptations. with what's going on. I'm going to ask you guys to do this kind of stuff. What if? These are really, really good, educated, and informed guesses. And that's what we need to be able to do. We need to be able to make good decisions, because there's so many factors that involve how we interact with an individual during any given massage. When we do find research, then we need to be able to read it to understand it, and then to be able to extract the information we're looking for. So this section right here is going to provide information on how you can kind of dissect a paper, so that you can find the biases and understand just how they did that, so that you can trust the information that you're getting from that paper. So these are all the parts. And a great friend of mine helped me with this section, and he has been a researcher and an educator, Glenn Himmel, for years and years and years, and was instrumental in getting the magazine, the journal that is produced by the Massage Therapy Foundation, indexed on PubMed. And so I always think of Glenn when I go through this particular information. So he came up with this idea of how do you read a research study, and then what does that mean to you? So we're going to go through this kind of quickly in the reading of it. That's really self-explanatory. I already mentioned that I was able to use meta-analysis and systematic reviews to justify my position on how I'm presenting this in the textbook. And how this was done was to use a Google search, PubMed searches, Google Scholar, compare and contrast various research papers, look at references that massage-related researchers have used. I trust them, like Ann Blair Kennedy or Nikki Monk, and go and look at those myself. I've read these, I've looked at these. Some of them are behind what's called a paywall, where I had to actually pay for them. But many of them on PubMed are you can see the abstracts at least, and a lot of them you can get the full paper. If you go to a library, the librarian might be able to get the full paper for you. So foremost, we want to be involved with safety. We want to make sure that as we provide massage for benefit, that we don't do any harm. And so massage is generally safe, but there are things that we have to be careful of. And aggressive types of massage, such as this ambiguous term deep tissue or excessive pressure, excessive cross-fiber friction, muscle stripping, where you're going down through a narrow base up and down a muscle, aggressive stretching, using tools to scrape and push. These can increase the ability for an adverse effect. So while it's rare that massage can cause harm, it does happen. And so we have to be always looking at safety first. Now, this is the section that is going to go through our main outcomes of relaxation, well-being, stress management, pain management, and functional mobility. And we are going to look at each of these through a research lens and read through these. And at the very end of that little section, here are the systematic reviews and meta-analyses that I was able to use. But there are also in the at the end of the chapter, in the reference list, there are individual references that I used that were clinical trials or something like that. I also try to have multiple researchers. I look for at least three research papers from different people, if at all possible, to support a statement that I have made. Then we get into our stress management. And as I've said before, the outcome of relaxation and well-being actually has the strongest evidence, and stress management is right behind it. Followed closely now by pain management. So the same setup is here. And you want to look these up, read them for yourself. Make sure that you have a solid understanding of, if you're going to speak, if you're going to say, okay, I agree with Sandy that there is good evidence to help people manage stress using massage, then you have to do your due diligence to understand what's going on with that. So an example of a justification statement after all this is, the research evidence is sufficient to support the use of massage therapy as a stress management approach. However, because ongoing stress leads to a variety of pathological conditions, the massage therapist needs more supporting evidence to devise a more comprehensive assessment process, to use massage interventions purposefully and cautiously to manage stress-related symptoms, and to recognize when clients need to be referred for proper health care and or medical diagnosis should the anxiety or depressive symptoms increase. Now, pain, we've done some good stuff in research with pain. The Massage Therapy Foundation actually supported research that was done in 2016, I believe. And as far as the overlap in an interdisciplinary approach between wellness, stress management, that continuum all the way to medical care, this overlap, pain is very hard to deal with. We've got an opiate crisis that we have got problems with, and they're looking for non-pharmaceutical approaches to pain management. And so massage has sufficient evidence to have us be part of an interdisciplinary team, as well as helping people in general deal with the typical aches and pains that we have. So here again are those systematic reviews, quite a few. So the statement, research evidence supports massage therapy as a pain management strategy. Because pain is related to pathology, it's important to be able to make evidence-informed decisions on adapting massage for each client and to support other professionals involved in that client care. All right, now this one, functional mobility, is a little harder. The evidence is much more scant. So we define what that is, and we like the other sections, and we start to look for the evidence, and we start to pull all that information together to understand what it might or might be not be. And this is a little expanded because this is overlapping into research related to connective tissue. There's been a lot of that, and then how we might, massage therapy might affect those tissue types more specifically. So we have to understand that. So this is a good read in through here to understand what might be happening with that particular tissue and how it relates to this idea of activities of daily living. And it seems to be more about slipping and sliding than it is about making sure that, you know, we're actually changing the tissue or something. That's not really supportive. So a little bit more complex in here and trying to make a case for massage and functional mobility. And here are the systematic reviews. And as you will see, the justification statement here is a little bit more ambiguous. Overall, it appears that a general full body massage can directly and indirectly influence many structures and functions to help a person adapt and cope and help to restore function. Here's the research on that. We may not be able to identify the results of individual specific applications. Okay, so I am going to massage this muscle and that's going to help you turn your head. Because massage encompasses many different elements that are all happening pretty much at the same time. Benefits can be derived from the quiet, nurturing presence of the massage therapist, the duration of the massage environment, and the unlimited variations in methods, pressure, speed, and so forth. So our next segment here is how we try to justify kind of our effects, how massage is affecting our body's physiology, and trying to bridge the gap, the translating of that into what happens in the actual massage environment and the actual methods that we do. So in order for us to do that, this is where we have to organize our thoughts around 4 main outcomes, 4 main approaches to care, 2 actions that generate the mechanical force, and then the 9 ways we generate the force by pushing and pulling. These are 9 ways of pushing and pulling. And then the 12 modifiers on how we can make our methods a little more of this or a little less of that. And then what actually happens, with all of that, what is happening in the body tissues and how is it responding to these various stresses that cause the tissue to change or the nervous system to fire. The tissue deforms temporarily, it doesn't change permanently. But that deformation is one element that is going to start to signal through the nervous system and in some instances mechanically on the spot. So this chapter this part of it can start to feel a little thicker reading. And so I just want you to remember that you're not reading for memorization here. You are reading for an understanding that starts your ability to comprehend and then use the information. So there's what we had thought, what we got changed when we thought about it. There's a lot of that idea here, and we're looking at that. We're trying now to make sense of how can we say these things? Can we say that massage is interfacing with the nervous system and the endocrine system, etc.? So the next section in the text is going to go through each of these. And I would not read these in one setting. I would go back and read a chunk and go do something and then read a chunk, and know that you're going to have to revisit this multiple times as you're self-studying on this. So this is the segment on the influence of massage on the nervous system and all aspects of the nervous system, including the autonomic, the enteric, the neurotransmitters, stuff that you should be and or will be studying in your science textbook. So this is where the overlap happens here. And I'm trying to justify, if I'm going to say there's a big interest in therapeutic use of cannabinoids, cannabis, marijuana, and we have our own system of cannabinoids and what might be going on. Can something that we do with massage interface with this particular chemical in our body? So mostly it's a combined influence. It's not just one. So we can maybe say, let's look at this bullet, a person who has had surgery heals faster with massage because there seems to be a decrease in cortisol and adrenaline, which can interfere with the acute healing process. And there's a potential for an increased and restorative sleep through pain reduction, which is pretty solid. And then there is also an increase in endorphin and serotonin, which may influence the ability for growth hormone, which is involved in the healing process. So this is plausible. And then same thing with the autonomic nervous system. And this will be reinforced through your science studies. You may want to read ahead in your science book as you're looking at this. I try to have the assignments overlap a little bit, but this can lay out, so this is an introduction to this information, and then you'll get more factual detail during your science studies or the other way around. And here's our somatic. This is our movement, our skin, our muscles, how massage may communicate here and what that might mean. The vestibular is our internal balance mechanisms and our innate built-in movement. What is hyperstimulation analgesia? This goes back to that, funny little thing we'd say, oh, you hit your thumb with a hammer here, I'll help with that, and I stomp on somebody's foot. That's a new novel stimulation. Hopefully, the new novel stimulation that we create is pleasurable and distracts the body from a sensation that is not pleasurable. And it talks a little bit about an overlap in a cultural system with the acupuncture. These points, there's points and points and points and points. And you know what, if you do a good thorough massage and you have a general idea where these points tend to consolidate, round joints, you're probably going to stimulate those. It might not be with a specifically focused intent like an acupuncturist would, but you know, if we're touching the area, there's going to be a stimulation. They seem to be in areas where there's high neurovascular anatomy. There's a lot of this stuff in these little spots. So, you know, just kind of read through this, get an idea. Always look at the pictures. Think about massage when you're looking at a picture, because you're going to be touching these areas directly or indirectly, which means you're stimulating them. So now here's circulation. And boy, do we have a lot of yes, we do, and no, we don't, and this is a big thing, and we have a lot here. My personal opinion, I think we affect it some. Certainly we affect it locally when we squeeze on something, when we squeeze out the capillaries a little bit. Certainly we affect circulation by affecting the nervous system, particularly the autonomic nervous system. Whether we can cause a deliberate change, I'm not so sure of. And there are some contraindications related to the circulatory system. Pathology, blood clots is one where there has been, it's rare, but there has been instances where massage has dislodged a clot in the lower limb, or dislodged a stent usually it's the lower limb, and then it has traveled up into the heart or lungs and caused some problems. But we might have an effect on this. So we can mimic normal. We can work from an idea of biologically plausible. It's the same with lymphatics. I mean, circulation is fluid. And again, hard science is kind of scant here. So when we look at these as specific adaptations to target a physiological function of a system later on in the textbook, we're operating from this biologically plausible idea. So a lot of reading. You're probably not going to get it the first time through. So this chapter is something I would put on my list to read maybe once a month, get an idea. Oh, now I understand that where I didn't so much. Same thing here with the connective tissue. And a lot of interest in this tissue as a target for a lot of the benefits that we achieve. These lines here are where the connective tissues tend to divide us into sections through the transverse plane, and then extending out from those are kind of like anchor points and guide wires where the fascia, the sheets of tissue, kind of coalesce and then change direction and connect. And so being mindful of these spots and the lines that connect these spots can help us adapt to how we might in a more targeted approach, put mechanical force into these areas. And mechanical force connective tissue is about mechanical force, adaptation, and there's even a communication system called mechanotransduction. So when you do a massage, you might want to slow down on these spots a little bit, or apply pressure here and have the person move the joint around in those spots to kind of more target where this structure, how this structure is designed. And then finally in this, we've got what is called the biopsychosocial, and this is another place where there has been a lot of interest. And it considers everything, not just the mechanical anatomy, physiology part. This is the more intrinsic part of this. This is where the therapeutic alliance and therapeutic relationship come into play. The idea of a compassionate, caring person who's applying a therapy that is supportive. A lot of this has had to do with pain, especially chronic pain management, moving a little way from the, okay, this pain is because this is tight or this is short or this is thick, or, you know, moving away from that a little bit and starting to embrace more the idea of chronic pain specifically. Acute pain is productive. Acute pain is fine. Chronic pain is where we have our issues, and how that is much bigger than a structure. So it's a real experience. And so the idea of massage as a biopsychosocial support structure, and how are we as the professional fits into this, and how we chat and talk with the client, and how we are dispensers of information that can help with the fear that can surround some of this stuff. And this is where research like this and content like in this chapter comes in. And as we close this chapter out with our little foot in the door here, information changes all the time. The information in this chapter was accurate as it went to print. Just before it went to print, I actually had them make a couple little changes based on information that had research studies that had been released. And but now it's been about a year, as I'm not quite a year, 6 months, as I'm making these videos that go with this. And when we start the revision process again in 3 years, there are going to be changes in here. Some of this information will be validated, and some of it will be shown to be wrong, you know, and that's okay. We just can't cling to those things. We have to be okay with that. So we get into our whole summary. We have all of our evolved support. This should be familiar. And then the next section is going to be all of our references. Now, in particular for this chapter, it's important for you to take a look at these and challenge yourself to look some up and read them on your own. And for some, there's an actual link right there for you. So what's nice in the electronic version is that you can copy and then go right to PubMed or Google Scholar, and you can put it right into a search program and see what comes up with it, and then see what research has come from that. You know, has this been cited in more current research? See if it still remains relevant. So there's a lot of it. There's a lot of it. So there you go. And then you know how to work these questions now, and continue to work with study groups. The answers, remember, are under content updates, and for HEC students, they are right there on your Canvas course for you. So we have completed our first chapter in the second unit, and it's an important one in the sense of us learning how to think and how to develop a thinking process, because that's what the scientific method is. It's a thinking process that allows us to work, do a little experiment and see if it worked. So, you know, if a client came in and you know, their hip flexors are a little tight, they've been sitting a long time, they were on a road trip and they sat a long time and they feel a little stiff in there. I can remind myself what the hip flexors are, and I can look at the connective tissue structures around it. I need to take a look at what the nervous system, the location, and what nerves serve what, maybe with dermatomes, and take a look at that. And I need to maybe look at other parts of the body that might also be involved with that. And then maybe I can decide, I'm going to do the little experiment. I'm going to use a little compression with some movement, and then I'm going to reevaluate, and I'm going to see, oh wow, that did make a difference. The range of motion increased by an inch. So we're always doing this, and I encourage you strongly to at least once a week get on either, PubMed is the one I suggest, and put in a search term related to massage and, or other words like manual therapy, and see if there's something new. You can filter with a date. Try to see what's new and up and coming, and always be open to changing your thought process around that. Okay. Now, the next chapter is indications and contraindications.